I would like to introduce you to our research presentation. Caroline and I chose to research the recent spike in opioid use among adolescents. This is Sandra Diana speaking. Opioids are medications that relieve pain. They can also change the part of the brain that controls emotions and cause a person to feel very relaxed and euphoric. Repeated abuse of opioids can lead to addiction. Medications that fall within this class include hydrocodone, Oxycontin, morphine, codeine, Vicodin, Percocet. And these medications are often prescribed for a variety of painful conditions. For example, dental work and injury-related pain. Both Carolyn and I are interested in this topic. She works with adolescents in the school system and has even seen some of her own students die as a result of prescription drug overdose. I work at an outpatient agency that provides treatment for individuals with substance abuse disorders. While most of my clients are adults, I have had the privilege of working with some adolescents. When I do intake assessments with clients, I learn what age the substance use began, and it is often during the adolescent years. Throughout our research, we found that teens are at high risk for several reasons. Adolescents have some misconceptions about prescription painkillers. We found some trends in our research, and when parents discuss substance use and abuse with their teens, sometimes they fail to address the prescription painkiller and how it can be a gateway to more illicit drug use, such as heroin. When parents fail to acknowledge this, teens are believing that prescription drugs are safer and not addictive. Most teens admit that it's easier for them to access prescription drugs because they're readily available, oftentimes found in the family's medicine cabinet. So all of these factors combined might be contributing to the rise in adolescents experimenting with opioids and oftentimes becoming addicted. So basically, our research project is attempting to explain the recent spike in opioid use and abuse among adolescents, exploring if there are any themes, such as a specific culture or group that we're seeing the spike in, or if it's across the board. We also wanted to explore the background of the adolescents to see whether trauma is involved, if there's divorce or death in the family that's contributing to the drug use. We found a study in 2012, the National Survey on Drug Use and Health reported that 9.5% of children aged 12 to 17 years reported illicit drug use among the past month. And prescription pain relievers were among the most commonly used. So we're hoping to find some results within our study that reveal some of the common factors among adolescent opioid use, as well as the prevalence of use. So how much they're using and what ages. Our learning objectives include, we're hoping to discover the themes among the opioid use and abuse and better understand the prevalence, how often this is occurring. Additionally, we're wanting to promote education and offer some counseling services and resources for adolescents and their parents to help combat this spike and see if the education is beneficial. Our research questions include: what are the common factors contributing to the rise in adolescent opioid use? And what can professionals do to educate and enhance outreach services to educate and prevent this continued rise.